throughout resident training, for periodontal disease, the classic treatment protocol is you do scaling and root planning, then you reevaluate the patient if needed, then you do traditional osteosurgery. I was never really a fan of osteosurgery, not because it's not exciting surgery. I love doing it. It's just due to the discomfort and some result I'm seeing after the surgery. And sometimes I see the infection inflammation reoccurs even after osteosurgery, and it's not, I intentionally didn't take out all the infected tissue, and sometimes body just react that way, then infection come back. So for some particular cases, the result is a little bit discouraging with the traditional approach. And a lot of times, when I was in my resident training, I'd advise people to get tooth extracted and look at the bone graft and the implant option. I heard LANAP during residency, and I was fortunate enough to get training before I completed my residency. So I started to do a little bit LANAP cases, and the result is tremendous. After the first case I saw, I thought the magic is real. The decrease of inflammation, the tightness of the tissue, and I did see some regeneration, which I was not anticipated or expected. So I think with the naps, the results are so tremendous. I believe it is kind of a paradigm shift for periodontology. I am now a lot more comfortable to tell patients I can save some of the teeth, and I thought it was impossible. So it kind of changed the way I practice. Well, I think overall it's going to change period completely. With traditional osteosurgeries, you can only do so much. If you have 80-90% of the bone loss, once you flap, then there's no bone left. So in order for us as a specialist to save teeth, to change our treatment philosophy, it's paradigm shift. It's going to change the way we do things. It's not only the laser, but it's a protocol. It's a study behind it. It's a science. I mean, for the LANAP training, for the first session, we really went over all the basic science, and we talk about the comparison of different lasers, different wavelength, and why is this laser in particular is so effective in treating periodontal disease. So I think fundamentally there's a scientific base, and there are scientific studies kind of support the protocol, instead of someone is just trying to say my laser work instead of yours. So I think that's important. With the PIP, so far the cases I have done, most of them have tremendous result with minimal invasiveness. And I have had cases implant are class 1 mobile. I thought I would have to take it out, but patient said after all the investment and time, they really wanted to do something about it. I say, well, let's try the PIP and we'll see how you respond. And we're able to stabilize the disease, and the implant is still there, and I don't see the inflammation or infection at this point. So it's pretty amazing. If you're like me, who is more concerned about how to help people treat their gum disease, stabilize their gum disease, and save teeth, I think this is definitely one of the most valuable tools out there that you can get.